Do you see progress in efforts to integrate HIV care into the primary health systems in developing countries, especially in southern Africa and endemic areas of Asia?
In order to answer the question, we have to talk a little bit about primary care. When a lot of us started working trying to build HIV treatment programs in many areas around the world, and particularly in sub-Saharan Africa, we starkly realized that the basic healthcare infrastructure, both in terms of its facilities, in terms of how they were equipped, and most importantly, the healthcare human resources, the people, the nurses, the doctors, the social workers, to provide all this care was woefully inadequate if it existed at all. This is one of the problems, of course, in delivering the prevention treatment for vertical transmission. How are you ever going to be able to prevent vertical transmission in areas where the women don't get any antenatal care, where the majority of women may deliver at home without any medical attendance? So in order to build those kinds of programs to deal with the HIV epidemic, it has become very important to build general healthcare infrastructure. Different areas of the world had different levels of problems with their basic healthcare infrastructure. And each area, each country, each province has to be looked at differently. One of the things I think a lot of us that have been trying to do this work have realized is that we need to use our AIDS resources, our AIDS dollars, very carefully, not just to build separate, segregated structures to deal with AIDS patients giving antiretroviral drugs, but to help advance the healthcare structure overall in the countries. To begin, as we formulate the AIDS projects, to have each increment of what we build part of enhancing an infrastructure that's going to exist beyond AIDS. I can give you a good example. Where I work in Ethiopia, we had developed a very large program taking care of over 10,000 HIV positive patients in a very, very poor area outside the capital city. Where we had built this program, there was absolutely no obstetrical support services at all. And as we began to give antiretroviral therapy with large numbers of patients, predominantly heterosexual transmission in that area of Africa, we of course were dealing with women that wanted to have children and women that were pregnant. So with everyone working together, we put in an obstetrical service in this hospital which did not exist. What we did was we didn't just open it up to the pregnant women that we were having in our AIDS cohort, but we opened it up to two of the large subcities in the capital city. The result is now we are having more than one delivery a day. We've been putting the capacity to do C-sections, and the entire population of these two subcities now are coming for prenatal care and supervision of the deliveries. As we build these programs, I think we absolutely have to be thinking with every step we take of how can we use these programs to help enhance the general healthcare infrastructure.